The pandemic exposed us, the parents, as failures in parenthood. We did not know what to do with you guys. 2 years we are with us. You were tired, we were tired, we let you go free.
Adolescent groups has of recent been identified as being in the largest proportion of pregnant women across the country. According to the 2021 District Health Information System report, a total of 31,567 cases of pregnancies were recorded, which translated to 1,050 pregnancies recorded daily. This indicated a rise in the cases from the 29,557 cases recorded in 2020. The increase in the number of teenage pregnancies was registered during the outbreak of COVID-19, where young people got subjected to early sex patterns, sexual gender-based violence, exposure to drugs, and other forms of exploitation.
Statistics now, there were so many pregnancies during COVID because the girls were rate-free, the boys were rate-free.
The District Health Information System shows that the Northern Region and West Nile were the most affected parts in the country. Teenage pregnancy health risks for mothers and children range from maternal mortality to neonatal and child mortality.
Of cases of sexual gender-based violence, many unreported GBV cases were still existing within the communities.
In 2021, objectives were set up to identify strategies that will help improve the access and delivery of adolescent responsive sexual reproductive health. Dr. Roger Zampira is the Executive Director, Nakuru Teenage Information and Health Center.
We also see that around 25% of those females who come and test positive for pregnancy, around 75% are from the community, those who are not in school. So those who are in school, we see fewer than 25%.
The second annual Conference on Adolescent and Young People's Safe Motherhood 2022, under the stewardship of Minister of Health and Nakuru Teenage Center, convened under the theme Strengthening Delivery of Adolescent Responsive Health Services. The conference is a follow-up on the 8 objectives set last year, but also to identify strategies that will help improve access and delivery of adolescent responsive sexual reproductive health services.
Slow down. The world is not ending with you today. Have those that we can as a government manage.
The Minister for Health in charge of general duties, Anifa Kawoya, challenged young people to be ambassadors of change in all issues relating to reproductive health services. Minister Kawoya says although young people still remain an endangered species that need to be protected through creation of safe spaces, their involvement is very key.
Why are you rushing? In this.com, my mother had 14 kids. And you think I would allow my daughter to have 14 kids? And you have gone through the school? Having many pregnancies have their consequences on the social sector, the education, the health centers. How many health facilities are we going to have for the young mothers, for the judges, and the babies?
Every last week of October, Uganda commemorates Safe Motherhood to reflect on the outcomes of the set objectives. Susan Naung and Andrew Sebira reporting for EBC TV.